Hi, my name is Thomas, and today I'd like to share with you some of the research I've found on ADHD while I was preparing my practice guidelines for EDN 509. This is my poster. I hope it's visually appealing to you, and I hope also the content is appealing. So let's get into it. Before I actually start the talk, hopefully you found the self-monitoring form on my discussion board. So you don't have to do this, but you certainly can have a go at it, and I'll explain my rationale for it later in the talk. You just need to fill in the blanks like I've done in the red. You will need to keep track of time, and you need to do that yourself. So if you want to pause the video now, pause the video, find your phone and start your timer. And we'll talk a bit more about that later on. So ADHD is one of the most diagnosed disorders in the Western world. It's a chronic syndrome of complex learning and behaviour characteristics. It's often solely characterised as a behavioural disorder, but it should also be considered as a learning disorder due to its impairing effect on executive functions such as working memory, language processing and higher order thinking skills such as planning, organising and reflection. There are three distinctive symptoms of ADHD. They are inattention, hyperactivity and impulsivity. Just before we go any further, you can find out more about ADHD from adhdaustralia.org.au. This is a website that provides general resources about the condition, as well as providing a voice and support for people with ADHD. I'll also put some other resources on there which reflect a variety of needs teachers might come across. So there's a good resource there from Kids Matter, which is good for home and school partnerships and building collaboration in that area. There's also a few other resources there specific for teachers and encouraging and enhancing their teaching. So, as we said a minute ago, ADHD has three distinctive symptoms: inattention, impulsivity and hyperactivity. Now, it's important to remember that even though we classify students and patients according to these three symptoms, each student, each person with ADHD is unique, and so that will be reflected in their spread of symptoms and how they present in the classroom. So you can see some of the behaviours or learning outcomes associated with inattentive behaviours are difficulty following, completing instructions, often losing things, not looking after their belongings, poor punctuality. Impulsivity displays disobedience, disruptive presence, risk-taking behaviour, rushes activities, gets excited about something, then loses interest quickly. Hyperactivity, again displaying risk-taking behaviours, constant chatter and or talking, difficulty sleeping, throwing things inside and running off from class. So that's just a taster of some of the behaviours or learning outcomes you might see. And again, remember, each person is unique, so they may have a spread of all three symptoms, they may have one, they may have two. So it's about identifying which of those features or symptoms are most emphasised in your student and then tailoring your strategy to help them. So we're going to be looking at two main strategies that you could potentially use in your classroom to support students with ADHD. The first is self-monitoring. So self-monitoring is a preventative strategy whereby students with ADHD identify and record whether they're engaged in appropriate behaviour at particular time intervals. It was developed via social cognitive theory, and it can be used to either encourage desired behaviours or discourage inappropriate behaviours. There's quite a few advantages to this strategy. So it has improved maintenance of behaviour change, particularly when combined with other behaviour management strategies. It has improved holistic outcomes relating to other interventions that parents or teachers might be involved with. It's less time intensive to implement than some other strategies. There's an opportunity to teach students independence and responsibility and adaptive social behaviours, which will benefit them not only at school but also in their life after school. It can be used in almost any educational environment, such as the classroom, outdoors, gym, excursions. It can be tailored to address a variety of learning and behavioural needs. Like we just said, not all students have those three main symptoms. They might have a mix or only one or two, and you can tailor this self-monitoring strategy depending on which symptoms they have. It's simple and cost-effective and can be used by a particular student in multiple settings to support their independence and autonomy. So the self-monitoring form you're filling out at the moment is an example of what students will be doing in the classroom. Now you might not have it set up quite so intensive as far as minutes, so you're doing it every 2 minutes. In the classroom you may get them to do it every 5, 10, 15 minutes depending on what is going to be appropriate for them. And so hopefully you can see that by regular use of self-monitoring with plenty of support and encouragement, this is a versatile and practical tool to assist learning and teaching of students with ADHD. Now some steps for how to implement this in the classroom. Firstly, you need to determine whether the student is capable of performing the target behaviour or learning goal. So for example, in your self-monitoring form that you have here, I set the goal as 100% focus on the presentation, so staying on task 100% of the time. Now that may not be an appropriate target for your student to stay on task 100% of the time, so you might set it at 50%, and then over time you can slowly build it up. The second step is to clearly define the target behaviour to the student, providing relevant modelling and examples. So again, staying on task, what does that mean? You might have a simple indicator that they need to maintain eye contact, and that's how you measure whether they're meeting that. Thirdly, you need to teach them the procedure, and that gets back to not just explaining what they need to do, but actually explaining the rationale for why they're doing it. So this isn't a punishment for them, this is actually going to enhance their learning. You then need to monitor the student progress, and that can be done on an ongoing basis, either formally or informally, and then conducting lots of follow-up with the goal being to wean them off this over time. I did miss a step there actually, step 3, so you actually need to design the form. So you can use something like this, or you can design something completely different depending on what you need. I think I got all that. Second strategy you want to look at is within task stimulation. So this is based on optimal stimulation theory, which proposes that all students have a biological need to optimise the amount of incoming stimuli, and that people with hyperactivity might require a greater level of stimuli. And so this helps us to explain why sometimes it's difficult to sustain their attention with low stimulation activities. Various studies have found that the addition of colour to simple tasks, such as search or copy tasks, resulted in improved attention and reduced hyperactivity in children and adolescents with ADHD. Now the timing is important with this because there seems to be a wearing off effect. So for simple tasks, it's better to incorporate the colour early on in the task, and for more complex tasks, like in this presentation, you should include the colour later on. And this was highlighted in the study where hyperactive students undertook a spelling task, which required them to use their visual memory, and students performed much better when the colour was added later in the task, allowing them to practice the task early and initially without colour. Now the choice of colours is also a significant factor to consider, and there's considerable research showing that people with ADHD have an impaired ability to be stimulated by blue-yellow colour schemes. And this was demonstrated by a video game trial where people with ADHD performed worse in a version of the game with a predominantly blue-yellow colour scheme. So again, our steps to implement this strategy: you need to identify those students who are not receiving optimal stimulation from tasks. You need to analyse the tasks for their level of complexity, and you can use a tool such as Bloom's. And then for tasks that are deemed simple, and that might be something which is a level of thinking just at remembering, you would incorporate colour early into the task. And for tasks deemed complex, so understanding or higher as a level of thinking, you would incorporate the colour later into the task. And remember that the choice of colours is important, so try and steer away from blue-yellow colour schemes. You may still find they work, but they probably won't have a significant effect compared to red-green colour schemes. So that was just a bit of a snapshot and a bit of a taste of what I was able to explore in my practice guide. So if you'd like to know anything more about what I've said, or if you'd like to ask any questions, just leave a post in my discussion box, and I hope you enjoyed that. Thank you.